All right, guys, let's just get right into it. We need to talk about the one thing every expectant dad is thinking about, but almost nobody is talking about: sex during pregnancy. If you're feeling a little lost or anxious about it all, don't worry. This is your straightforward guide. Let's do this. Because let's be real, this is that question, right? It's not exactly the kind of thing you bring up with your friends over a beer. It feels awkward, it feels personal, but trust me, you are definitely not the only one wondering about this. I mean, that's what it all boils down to. What's going to happen? So if you're feeling confused, maybe a little worried, or just totally in the dark about what's okay and what isn't, you're in exactly the right place. We're going to break down what's safe, what's normal, and how to get through this new chapter together. Okay, first things first. Let's tackle the biggest fear right out of the gates. For pretty much every guy, the number one concern is this safe for the baby? So we are going to hit that one head on. This is the big one. This is the thought that can really mess with your head. You've got this powerful instinct to protect, and the last thing you want to do is cause any harm. It's a totally valid fear. So what's the real medical answer? The answer in a normal, healthy pregnancy is a very clear, very definite no. It absolutely does not. Let me show you exactly why that's a medical fact. Think about it like a high-security bunker. Your baby is incredibly well protected in there. You've got the uterine wall, which is the super strong muscle. Then the baby is literally floating in the sealed-off amniotic sac. And the entrance, the cervix, it's sealed shut with a thick mucus plug. Seriously, the truth is early miscarriages are tragically common, but they're caused by developmental problems, not by anything you did. Okay, so we've put that first fear to rest. But what about the other one? You might feel her uterus tighten up during an orgasm and think, whoa, hang on, are we kicking things off too early here? And again, the answer is a solid no. Those little contractions, they're called Braxton Hicks. You can think of them like practice reps for the uterus. But they don't actually start labor. Her body is way too smart for that. It won't respond to labor-inducing hormones until the baby is actually ready to be born. Put it this way, if sex could reliably start labor, your doctor would be prescribing it instead of giving her an IV. Now, here's the important exception. While sex is safe for most pregnancies, there are some specific high-risk conditions where a doctor will put up a red light. This chart shows the big ones. If your partner has any of these, her doctor's advice is the only thing that matters. This is one of those times where you just listen to the experts, period. All right, so we've got the medical stuff out of the way. Now let's shift gears and talk about what's going on from her perspective. Her body is on a seriously wild ride, and if you understand the map, it's going to make the journey a whole lot easier for both of you. This right here is fascinating because her libido often follows this really predictable U-shaped pattern. In that first trimester, she's probably exhausted, maybe feeling sick. Sex is likely the last thing on her mind. Then you hit the second trimester, and for many women, it's this kind of golden age. She feels better, has more energy, and her libido can shoot way up. But then the third trimester hits, and with all the physical discomfort, it's totally normal for it to drop off again. The key takeaway here, this is biology. It's not about you. Another huge change is this massive increase in blood flow down there. And honestly, it's a real double-edged sword. The upside? It can mean she's way more sensitive, has more natural lubrication, and can have even more intense orgasms. The downside? That same hypersensitivity can become, well, overwhelming. What felt incredible one day might be just too much the next. And that's why you have to keep talking, all the time. Okay, time to get practical. Knowing all the science is great, but what you really need is a playbook. How do you actually do this when her body is changing every week? Here are the rules and positions that actually work. These are the 3 golden rules, especially as you get into the later stages. Number 1, try to avoid having her lie flat on her back for too long, because it can press on a major blood vessel. Number 2 is obvious, no pressure on the belly, ever. And number 3 is the most important. Let her be in control of the depth and the pace. Things are just more sensitive in there, and she's the only one who knows what feels good. So what does that look like? Well, Woman on Top is probably your MVP. It checks every single box. She's in complete control of literally everything. The depth, the pace, the angle, and of course, there's zero pressure on her abdomen. This one's a winner pretty much the whole way through. Another fantastic option, especially in that third trimester when comfort is king, is side lying or spooning. This takes all the weight and pressure off her belly and her back.
It also has a built-in safety feature. It naturally limits how deep you can go, which is often a lot more comfortable for her. Pro tip, grab some pillows. Use them to support her belly and back. They're your best friend.
Okay, I need to be completely serious for a second. This is important. Oral sex is generally fine during pregnancy, but there is one critical non-negotiable rule. You must never blow air into her vagina. It can cause something called an air embolism, which is incredibly rare, but it can be fatal for both her and the baby. Out of everything we talk about, this is the single most important safety rule you need to remember. So, we've talked a ton about her body and her experience, but now let's talk about you. Because what's going on in your head is just as important. It is 100% normal to feel a little weird or for your own desire to change, and we need to understand why. There's this idea called the protector's paradox. Basically, your brain is shifting gears. You're becoming a protector, and that powerful primal instinct to keep your baby safe can actually put a damper on your own libido, almost like a subconscious safety switch. So if you feel your own desire dip, please know you're not broken. Your brain is just rewiring itself for fatherhood. It's normal. And here's something else guys almost never admit. Your attraction to her might get complicated. For some guys, she's never been more beautiful. For others, it's just different. This idea of a third state really nails it. You see her as something sacred, as a mother, and maybe not just as your sexual partner. Whatever you're feeling, it's okay. It's normal. All right, so you've navigated the whole 9 months. Congratulations. But what's next? Well, the postpartum period, which some people call the 4th trimester, brings a whole new reality to your sex life. It is time for a serious reality check. First up, the timeline. No matter how she gives birth, the doctor is going to tell you to wait a minimum of 4 to 6 weeks before even thinking about intercourse. And listen, that is not a suggestion. It's a medical requirement. Her body has just been through a major physical event, and it needs that time to heal properly to avoid pain and infection. And even when you get the green light, it's not like flipping a switch. 3 things you got to be ready for. 1. Hormonal changes can cause major dryness, so a good quality lubricant isn't just a nice to have, it's a must have. 2. Pain is really common at first. Be patient. And 3, this is the big one. Be prepared for a major libido mismatch that can last for a long, long time. We're talking 18 months or even more. She's exhausted, her hormones are all over the place. Your number one job is patience. And that really brings us to the main point of all of this. This whole period, pregnancy and postpartum, isn't about trying to hang on to your old sex life. It can't be. It's about adapting. It's about communicating. It's about redefining what intimacy even means. The real goal here isn't just sex. It's about staying connected physically and emotionally so that when you come out on the other side of this, your bond as a team is stronger than ever, ready for the amazing journey ahead.